I'm really excited to be talking with Urooj Ansari today. Urooj comes from Integrated Spine and Joint Institute, where I know she brings a lot of non-healthcare perspective into healthcare to try to build a better patient experience. And so my team has talked about Urooj a lot on internal meetings, talked about how OhMD is used at the practice, and I'm really excited to kind of dig in and get to know you. So thanks so much for jumping on and talking to me about what you do.
Yeah, no, thank you for having me. I'm so excited. When I
Yeah,
got this opportunity, I said, I'm all for it. Let's do it.
that's awesome. Yeah, thanks so much. This is always it's always fun to meet new people that I think we probably have a lot in common in how we think about the patient experience. So I guess what I'd love to start with, I've kind of read through your biography, kind of where you come from, and how kind of it frames the way you think about healthcare. But can you give me a little bit of background on what you've done and how that translates?
I've worked at a couple of different advertising agencies in New York. That's kind of where my career set off. I was there for 6 years working at a couple of different firms. My clients were Crest White Strips, Folgers Coffee, Cadbury Chocolate, and then I went to Pfizer and started marketing for some arthritis medication, Celebrex, and kind of getting a little bit in the pharma world. And then I ended up getting married, and my husband is the doctor, Dr. Ansari. We ended up moving down to Florida. And so for the first 6 years of being in Florida, I worked at the Walt Disney Company. And there I worked, again, in advertising and in the marketing realm on Disney Cruise Line, on the theme parks. So Epcot, the Flower and Garden Festival, Food and Wine festivals, the branding, their campaigns, how a consumer sees it outside of the park and how do they see it inside of the park. So kind of making sure that both of those worlds kind of match and go together. And one of my most exciting experiences was working on the rebranding of Disney's Animal Kingdom Park when it shifted from a day to night park. So just like the other entertainment experiences that were added on, and how do people view Disney's Animal Kingdom, and how do we change that perspective to let them know that it is a park that you can spend a full day at. So that's kind of the world that I was in.
Yeah.
And my husband, who is the pain management doctor, worked at a couple of different private practices, and just got some good experience under his belt. And we'd always kind of talked about we wanted to start off our own practice, just something we wanted to do with my business and marketing experiences, him being the doctor. And so we just pulled the plug and said, let's do it. Let's start it up. And so that's when we opened Integrated Spine Joint Institute. It was late 2019 when
Okay.
we really officially opened, just because the credentialing with the insurances, it just takes so much time,
Yeah.
So that was just a little bit what delayed us. But yeah, we kind of just hit the ground running. And really what our focus was is how do we stand apart, and why would someone think about Integrated Spine and Joint Institute versus any other office, pain management office. And so the one big thing that we both were really passionate about was building a patient first approach, or like a patient first experience. So like from the minute that they find out about us, call us, come into the office, all of that, it's, trying to make it with them in the center of it and tailoring to all of their needs. So that's kind of how the practice was born. And we stay true to that even now, and we continue to build on it. And we're very open and excited to try out different opportunities that help us make that experience even better, make
That's
it more seamless.
yeah. Well, I think what excites me about thank you for that. Like, your story is exciting to me because I've been in healthcare for a long time, but what I think is most exciting is when people that have different perspective, that haven't been in healthcare their entire life, they come in with consumer experiences from other verticals. I mean, Disney's a great example, right? Like, what other company focuses on the experience more than Disney? And what can you learn from that? And how can you apply some of those learnings to healthcare when it needs it most? And so I love, I myself often look to other verticals to begin to start solving problems. And in fact, that's where OhMD originally came from. We didn't say, let's build a better patient portal. We said, how do people communicate? And how can we bring better communication to healthcare in a way that everyone understands and that people value? So, so I love that kind of trajectory. And so I guess just follow-up question. I'm already going off script here. Follow-up question that I'm just really curious. So when you first got into healthcare with your husband and started thinking about in 2019 or earlier, that experience you wanted to create, how did you think about things you had learned at Disney, launching the night Animal Kingdom experience? Like what pieces of that drew you into thinking like how you could apply those experiences to healthcare?
Yeah, I mean, anything that, like the medical industry, it's a service, right? So we're providing a medically related service. So it's bringing, again, that customer service to like the top, and making sure that that is what we keep in mind in everything that we do. So just kind of thinking about what is it that a consumer wants. I mean, they weren't going to Disney Animal Kingdom because they didn't feel like it was a full night, a full day experience. So they wanted, they're looking at other avenues. So how do we solve for that? We brought in the nighttime. So it's like, you're kind of looking at what is the consumer looking for and how do you solve for that? And so what we were learning from, based on what we talked to friends, other patients that my, husband worked at, was, they felt like the minute they walked into a medical practice, it just felt very stale, very unwelcoming. They were always waiting. They're like, I have a haircut appointment. I go at my haircut appointment. I'm seen within the first like 10, 15 minutes. Why is it that when I go to a doctor's office, I'm waiting for an hour or so and my whole day is gone,
Yeah.
So it's like, how do you kind of take those nuggets and build again on that experience to ensure that it is a pleasant experience and something that, you could potentially look forward to. So with that in mind, we when we found our office space, we wanted to decorate it in a way to make it feel welcoming with comfortable sofa, sofas to sit on. Patients are in pain, so we wanted to kind of let, if they're going to be sitting on like these plastic chairs, it's going to make it worse. So, from the minute they kind of walk in to just getting welcomed by our staff, feeling that, they're being cared for, that they matter. So that's kind of how, we trained our staff to treat them. And, every step along the way, we wanted to, the biggest thing was building a schedule that allows you to maximize as many patients as you can see possibly, but in a way that when they're there for like dedicated care and they're not just waiting and waiting. So, just the whole overbooking and, all of that, we wanted to make, and my husband, Dr. Ansari, is very particular about the schedule. And so he like physically like sat there and kind of built it out. And Athena was great because it really helped us and gave us that flexibility that we needed to ensure that we could build those schedules in a way that would allow us to see as many patients as possible, but also see them in a way that we could kind of get them in and out. And when they're in the office, they're there for their dedicated care.
That's amazing. So I just love that the idea, this is something I had never thought about, even as a person with back pain for a long time, that I did eventually figure out. But the idea that, the experience for those patients starts, even before they enter into the office, but like thinking about the chair they have to sit in, and making sure that that's something that is addressing to a certain extent kind of what they came in for, and making sure they're comfortable. Like that's amazing. I love to hear people thinking about things that I had never even considered as a part of the experience. So, okay, so taking a step back, I want to get to the athenahealth thing a little bit later, but COVID, obviously, the last year has been different, to say the least. We've had to be flexible, and there's been a lot of practices that have struggled with, depending on specialty and location, of course, there's a lot of variables, but a lot of practices that struggled during the past year. And it seems like a year that you have done really well. And I'm curious about what would you attribute your success over the past year to in these, really uncertain times? Like, what would you point to and say, like, this is why we've done well?
Initially the first part of the year was pretty tricky. Again, people weren't really looking to leave their houses, and they were just nervous,
Yeah.
so we made like telehealth kind of front and forward, especially with our existing patients. So taking care of their needs, and doing everything virtually. And the great thing about Athena is you have patients chart all of that electronically. You don't physically have to be in an office. We can send lab orders and imaging orders and prescriptions and all of that with the touch of a button. And so, being able to handle that virtually has been key, because we've been able to help our patients, but yet, like, help build their trust in us. And then the way we had dealt with, the thing with pain is, if you're in pain, you want to get treated, right? And I think people
Yeah.
were trying to avoid going to the hospital and things like that. So they were kind of looking out for an office that would be open, that would safely do things. And so we had a lot of our safety measurements in place, with social distancing and the way that we were scheduling patients in office and all of that. And so we were able to attract a good amount of new patients. And so the initial patient visit would always be in office, so that the doctor could evaluate them. There was certain circumstances where even that was telehealth, but it's a little bit more difficult to do, because he really does need to kind of see, like, where is the pain coming from,
Yeah.
what is the extent of, what can you and can you not do. So having that first in-person visit was very important. So we did that in person, and then everything following after that was virtual. So we
Oh,
kind of
wow.
kept them in their like long-term care to still see them, but it was done virtually.
Wow. So, and how do you think about that moving forward, right? I think every specialty is different. The extent to which telehealth can be used as a percentage of all visits varies pretty wildly. Um, as you move forward, do you see telehealth playing an important role beyond COVID, when someday we don't really have to think about it as much, hopefully?
Yeah, I mean, it's nice to be in the convenience of your office or your home, or whatever, to do have some of those follow-ups. And I think even doing a few, like two or three, back, like, if you need some of those appointments, I think it's fine. I think after a while, though, it is important to have that touch base. So now that people are getting more comfortable coming in, the way we're handling is, we'll have a few telehealths, and then we'll have an in-person and in-office follow-up, and
Yep.
then a few more telehealth, and then an in-office, because it's just helpful to see how has the pain improved, or if there is a difference, where is that going. So it's still
Yeah.
important to have that face-to-face, to have that more that examination. So we're kind of doing it a little bit like twofold.
Yeah. So you've got this hybrid kind of setup, and how do you
Yeah.
feel that? Do you feel that people appreciate the convenience and still get the value out of the telehealth visit as they would have otherwise coming in?
Yeah, I mean, the doctor still spends as much time as he would if he was, walking into the room and talking to them.
Yeah.
This he's just on the phone, and he's kind of asking his questions. And if something does seem a little bit like unsure, and he's not able to gauge, then he would ask, let's do a follow up in person. If you can come later this week or the next week or something. If something isn't, they're having a hard time understanding. But for the most part, the way that they've been going, it's been going really well, and it's
That's
been
great.
helpful for, I think, both sides, for us to also continue to manage a limited number of people in office, to make sure we're still making sure that we have the social distancing measurements in place,
Yeah.
but yet being able to help a bigger number of people as well at the same time.
Okay. Yeah. So that's, I think, as I think about kind of the role that telehealth plays, and the transition that you probably had to go through, what did it take to figure out? You had a lot to figure out at the same time, back in March, or even potentially earlier. How do you solve for new workflows? What technology do you need to operate efficiently moving forward? And then, just there's a lot of things to solve for. How did you think about vetting technology, and how did that relate or not relate to Athena Health as your EMR vendor? Where did you start in kind of going down that path to explore how to solve these new problems?
Yeah, I think one of the bigger issues was um, being able to, be available to patients and have that open flow of communication, like that two-way communication between us and them. the one thing that I think that I don't like about doctor's offices is when I'm calling to cancel an appointment or reschedule or something, you're on hold for 30 minutes, and I get it. Everyone's busy. But,
Yeah.
it's kind of hard just for like one simple thing. You're just on the phone for so long. And so that was one thing that I think was like really key to me. And I think as we were getting busier and as telehealth and everything was becoming more and more in focus, and there wasn't a lot of in-office visits, it was all through the phone or, trying to get back to them like over email or what, we were feeling a little bit of that pinch. And we're like, wow, if we had some sort of like texting service that we could just message them directly and answer some of these questions, if it's rescheduling, canceling, what time is their appointment, things like that, and, easier things that you can just pick up and answer. But when you're in the midst of running a clinic and, ensuring that work is flowing well, and again, patients are at the office, we would want to ensure that they're having a pleasant experience, not waiting long, being seen by the doctor, and everything is kind of flowing well. We were really seeing that there was that need to have more of that two-way conversation. So our
Yeah.
office manager was kind of like looking through Athena Health Marketplace and was like, okay, what can we find, like a text messaging service? And then that's when she came across OhMD. And we kind of learned about it and then contacted you guys, and it's been such a game changer. Just the ease of us being able to communicate with patients and vice versa, with the way that they're able to get a hold of us in so much more of a seamless and easier way, and not feel frustrated to like have to call or have to, be on hold for so long for a simple question.
Yeah.
And it helped
Yeah.
phone lines,
Yeah.
not constantly getting phone calls and all of that happening while we're trying to take care of our patients as well.
So I was going to say that resonates, I think, probably with a lot of people, but it definitely resonates with me. And it's funny because like everyone else, like I'm a patient from time to time, and I forget oftentimes how painful it can be to pick up the phone and call about getting an appointment or changing an appointment. And just it seems so simple to break down kind of the barriers to doing that and give the patient a good experience around that. But I think what you're doing, and texting, it feels like such a simple solution, but that's the power of texting, I think, is that it's so simple, but that's where you can reach the patient, and that's what changes the experience for them from the minute that they start having that conversation. And so I just think back to like the last time I had to call and set up an appointment, and it was 2 days in a row. I left a voicemail and no one ever got back to me. And then I was just like, meh, maybe I'll just tough this one out. Like, maybe I don't need to go to the doctor. And that's, maybe that's fine for some visits, but it's not fine for a lot of visits. And that's such a problem when it comes to improving outcomes. If the friction is stopping people from setting up appointments when they think they should, then we're not solving problems, right? And so I think the communication is such an important piece, and it's great to hear people that understand that, because it's not everybody that is really on board with simplifying communications in that way.
Exactly. I remember I was actually trying to cancel an appointment for my mom. I think it was like for like her endocrinologist or something, and I was on hold for 35 minutes. And I was like, I can't be on the phone for this long. So I even emailed them to be like, hey, because I don't want to have to deal with a cancellation fee. I'm like, I'm trying to cancel. I'm doing my part. I don't want to take this slot for someone else that may be needed. I don't want to, but I just need to communicate to them that like I need to cancel that. And so I did it through email, but I still didn't hear back. And then second day again, I had to call, like I had to remember to call them again. And it's like, it became a thing when it should be a thing, It's an appointment. It's not like I'm making an appointment. When do I have to fit it in? And what time is going to work, and my kids and my work and, all that. But it's like, all I have to do is just cancel this. But it was such an ordeal. And that's when I realized, I was like, like this is how it feels like when you're on the phone for, and you can't get in touch with anyone, and you want to just let them know because A, you don't want to take a slot, and B, you don't want to be hit with a cancellation fee,
Yeah. It's good for people like us to be reminded what it's like to be a patient in the vast majority of situations, because it gives us, for me, it just fuels me to think about better ways to solve some of these problems. And I think there's a segue coming here, but again, like going to other verticals and thinking about how restaurants manage appointments and how consumers interact with them, or haircuts, whatever. Like there's so many parallels to draw in consumer life, and we've learned so much about how to optimize those things.
Totally.
It's just exciting to think about still how much room there is to improve the way that we treat patients.
Totally. Totally. Yeah. It's all about customer experience, right? Like we said, we're booking a haircut, or we're going to a restaurant, or like all of that, from the minute you make your reservation to enter the door to the way that you're serviced. I mean, if you have just bad service, you're just gonna, even though the food was great, you're just not gonna want to go back.
Yeah.
When you went in there, the food was great, the services was exceptional, you had this whole experience. So that's kind
Yeah.
of like how we take a look at it. It's not just about them coming for their medical appointment, it's for the experience. And so
Yeah.
that's how we handle it, I think.
Yeah, for sure. So, okay, so here's the segue. As kind of going back to part of the conversation we were having before, you come from a largely marketing background in different verticals, and so you've seen and experienced a lot about kind of how to design for the consumer and that experience. How at Integrated Spine and Joint Institute, you've put a lot of effort into creating an experience, and you've also kind of, it sounds like, put effort into figuring out how to harness that experience to help grow the business, because in a marketing frame of mind, that's what you do. And so you think about, how do you get people to talk about it? And we think about, as a marketer myself, word of mouth and reviews online, and how do you build awareness about what you do that's different? Can you tell me a little bit about how you think about that experience and the impact that it has on either word of mouth or getting people to leave positive reviews, and all of that kind of downstream marketing impact?
Yeah, I mean, when everything is kind of bundled as more of an experience, and it's a really pleasant one. I mean, the way we kind of think about it is more long term, right? So in the short term, we might have to do certain things that, just to like help out the patient, to make it just an exceptional experience for them. And so our whole goal is to think long term. So yeah, it's not about like jamming people in, overbooking and things like that. It's about giving them that dedicated time with the doctor. It's about welcoming them in when they're in the practice. It's about making them feel like they can trust you with their care, with their needs. And it kind of builds a more of a long-term relationship than just, hey, you're coming in for this pain and then off you go and that's it. It's really kind of harnessing that relationship. And we really focus on that because it's important, in order to continue that long-term relationship, and then also for them to, you know leave you a good, 5-star review, so that other people can learn about you, and also, tell their friends, word of mouth. That's so important. I think in this day and age, you're doing your research, but I think ultimately the deciding factor is those reviews.
Yeah.
I mean, I think about it when I'm ordering food from a restaurant, like, oh, like this place has this review and this has this review. What is it about this place that's good? And you're kind of, it really helps you make that decision. So if there's two offices that have pretty much same services, but one has a certain sort of like 5-star review versus someone who may not, that's a deciding factor. And the funny thing is, we've actually heard that from a lot of our patients
Hmm.
who will just be like, oh, how'd you hear about us? And they said, oh, well, I called up, I looked up in the insurance, I called the insurance company, and they gave me a list of different offices. I Googled them. You guys had a 5-star rating, decided to make an appointment here. That's kind of
Yeah.
like how it happened. I'm like, well, that's really great to know. Well, please, if you had a pleasant experience, please leave us a review as well, just so it helps kind of build that relationship with them, and also for others to,
Yeah.
potentially see and what to like, to know what to expect, because then it helps them build a baseline. Okay, the doctor spends time with you, the staff is welcoming, the office is clean, it's a really pleasant experience. You kind of have that baseline already there, and then when they come and they experience all that for themselves, it kind of just puts the cherry on top to be like, oh,
Solidifies,
that's,
yeah, the whole
yeah,
thing. Yep.
yeah, exactly.
So, gosh, that's awesome. I think as we think about, again, kind of going back to the experience and creating something that's exceptional, I've listened to you talk about how you've used different technologies, and you've given some anecdotes around how patients respond to certain things. Like, you very clearly thought about what are the most painful things in healthcare, and you're addressing pain points. So this is, again, like, this is something a marketing person does. You figure out what the pain point is and you figure out how to address it. And so I love to hear you talk about some of this stuff. And so, let me ask you about, I think, at least two, maybe three different things that I've heard you talk about. And I think one is the intake form process, right? Like you walk in, again, speaking from experience on the patient side, you walk in and they hand you a clipboard. It's got 10 pages of paper on it. There are 10 pages you have to fill out, and you've already filled them out, a month ago.
Yes.
How did you solve for that? And what did you hear back from patients in solving for that process?
Yes. Well, again, with the practice that we have with pain management, you not only have the 10 pages that you have to fill out for the patient intake, there's another 10 that are about our policies, right? And so you have 20 pages that you're printing out, clipboarding, scanning, putting on chart, all this and that. And you're taking up time that the patient has when they're coming in to be seen, they're in pain, and now they're sitting there scribbling all this stuff. I mean, that's essential because we need it, but it's also just delays the time that they're there, and they could be spending that time, that valuable time, being actually talking to the doctor. So when we actually we're talking to OhMD and learned about the texting services, one of the big things that got me so excited was the link to these forms. And how you can send these links over text messages or email or whatever, and the patient can, at their own leisure time prior to their appointment, can fill out their paperwork and hit submit, and then it comes to us and we can just download it, upload it to the patient's chart, and before the patient is even there, all of that is already taken care of. It's already organized. Our ducks are in a row, and the patient comes in, they get checked in, they go to the room, they're getting their vitals taken. The doctor already has all the information he needs in the chart. He's kind of already starting his plan. All right, based on what I'm seeing here, this is where the pain points are. This is kind of how I'm thinking about it. And now the last step is to do the evaluation to then really solidify this plan for the specific patient. And so that whole process has allowed us to streamline just the amount of time that patients have to spend at a doctor's office, and also just helped us really organize ourselves so that when the patient is there and in our office, we're really dedicating the 20 minutes or whatever, 30 minutes that they're there on their actual care. I remember I was in the back. So usually in the office, we have our front desk, and then our, medical assistant. And then I'm in the back doing like billing and claims and all sorts of things, and just other miscellaneous things. And I remember hearing a patient, she was like a morning appointment, and she came out and she was talking to the girl at checkout, and she's like, "This is the best doctor's appointment I've ever been in." She's like, "I was in and out in 20 minutes. That's never happened." She's like, whatever paperwork was done, I did it, and I got to see the doctor pretty much right away. He built out this whole plan. I'm on my way. I'm ready to start my day. And, I was just like sitting in the back being like, this is what it's all about. Like, this is the reason why we have these tools to help us, so that we can really help tailor the patient's experience and really make it about what they need, And it really kind of helped us, again, like I said, keep us organized, and it actually allowed us more flexibility and openness in our schedule. So we were able to fit in maybe a few more patients in that needed to be seen rather quickly because we had these tools.
Got it. So that was kind of my next question on the scheduling side of things. So it sounds like because you've optimized some really important processes, it allowed you to clean up what otherwise can be a little tricky on the scheduling side to make sure that you can maximize the time with the patient. Is that, and it sounds like that's partially due to the intake process, and I'm sure there are other variables there, but anything else there you can speak to on the scheduling side and really optimizing for that?
Yeah, I mean, it helped us kind of, like I said, like just keep everything more buttoned up. So when they're there, we know that if they've already done their paperwork, they'll probably be in and out in like the 20-30 minutes. And then that'll allow for space for a follow-up that may be needed in person, or a procedure that might need to happen, or any other emergency cases that might need someone, to fit in more quickly. So it's allowed for us to, just be more organized as a whole. Like if we have all of the patient's forms and all of that already taken care of, the doctor also, if he's running a little ahead, he can kind of get ahead in his process and get things started, because the information that he needs, that he usually waits on, is already there, readily available to him.
Makes sense. Yeah, I love that. You've identified all of the most painful parts about going to the doctors, and I think it's really important to note that, like, what everywhere else, whether we're going to a movie or going to a restaurant or we're going to get our haircut, like it's not as healthcare isn't generally a lot of fun. You know, like I think the only point I think that healthcare is fun is maybe when you're expecting a child, and then like you have, you know, this exciting part about healthcare, right? But
Yeah.
everything else is like,
Yes.
yeah, I'm in pain because
Right.
of X, Y, and Z. And
Yeah.
so a recognition that healthcare is not generally fun, and addressing the other things to make this kind of the entire process better, from the intake to the communication outside the office, to the schedule itself and the time with the doc. Like that's what healthcare should be. So everything you're saying is really resonating with me. I love it.
Yeah. Yeah. I mean, the funny thing is you say that, and I agree, like doctors' offices are not fun. But the one funny thing is that like when Dr. Ansari is asking, okay, like, we'll schedule you for a follow-up, we could do a telehealth or even in office, a lot of our patients be like, actually, could we just come in office? We just like coming here. Like it's
Yeah,
like with things, I guess, being shut down and not as open and whatever, they kind of just felt comfortable coming to an environment that was safe and fun for them, and a pleasant experience, right? So they were opting that when they had the opportunity to just take the phone call or the video call at home or wherever,
yeah,
they're opting to like drive in to come in. And he's like, sure. Like for some people,
yeah.
like if you would like to, like no problem.
You know, you've done something really special when
Yeah,
patients want to come in.
yeah. So like when he tells me this, I'm like, that's pretty amazing. Like, they actually want to come, and it's like
Yeah,
the interaction that they're having with the staff and how they feel when they're here. I'm like, that's awesome. Like it just really makes me happy to hear that.
yeah, that's amazing.
Yeah.
That's not a common story,
Yeah.
as we all know. That's amazing. So I guess you mentioned telehealth. I just wanted to quickly go back to that. So you've gone through this process of implementing telehealth. Are there things that you wish you did differently, or if you were talking to a practice manager, or a doctor that was looking at how to implement telehealth, are there things that you would advise against or advocate for? Like, what are the most, kind of important points or learnings from that process for you?
Um, I do feel that it's really important to definitely build like that initial relationship with the patient. So I highly encourage the initial appointment being in office if possible, unless it's like medically necessary that it couldn't be. But definitely building that baseline, having that baseline relationship kind of solidified so that the patient kind of knows what does the office feel, who are the staff, how is the doctor, and all of that. Because then when they're actually taking that call from the house, they kind of know who's calling them, right? And it's
Yeah,
like they have that level of trust and that level of comfort to be telling them about their health needs. So I think that's been really, really big in terms of how we've kind of functioned during
yeah,
this time. And just also, again, with telehealth, it's been harder, right? Because they're not having that same level of experience of coming in and having those interactions. So if it is that they're reaching out for a question, again, through like our texting or our phone, like giving them that time and those responses in a timely manner so that they still feel like they're part of the practice, that they're still an existing patient versus just this one person who we call every so once in a while.
sure.
So we really do make an effort to, when they are questions or they're calling for something or they're texting us for something, that we do get back to them like pretty much as quickly as possible. Or even if we can, it's a bit more intricate, to just let them know that we've got your request, we're working on it, and someone will get back to you in the next 24 hours. Just having that level of that communication, the back and forth, I think has really helped us to really foster that relationship and that trust between us and the patient.
Yeah. So to me, I guess what I'm hearing is the patient relationship is really important.
Mhm.
And how do you build on the patient relationship? You establish trust, and you find ways to do that, and you simplify and improve communications. I think you make a really good point that a lot of people miss, at least initially when thinking about texting, and that is that you have oftentimes this initial pushback on texting where people feel like, oh no, like I'm going to get hammered with text messages all day, and
Mhm.
it's going to be this whole thing. And how am I
Mhm.
going to get anything else done when I have to respond to people immediately to their questions? And I don't think that's what patients expect really from anywhere, right? That's
Yeah.
not really what they expect. What they expect is that I think, again, like, tell me if this is off in any way, but what it seems like patients expect is that someone is paying attention, someone cares about their request, and that it's being addressed. And it doesn't have to be addressed immediately.
Yes,
Just knowing that
exactly.
someone saw a message come in and is working on it feels like half of the battle, right? Versus I left a voicemail and it went into a black box, and I
Right,
never know whether that is gone forever, if I'm
right,
going to have to call back 2 days later, or or if someone's really working on it.
right.
Does that seem like?
Totally it. It's
Yeah,
that acknowledgement, right? Like, oh, okay, I
yeah,
sent this question in, and yeah, it's might be a bit more complicated. It's not just simple as cancel my appointment. What time is my appointment? I'll be 2 hours late. That's different. But if it's a little bit more complex, just letting them know that we're working on it and we'll get back to you at X amount of time. And then it
yeah,
actually alleviates us as like staff members at the practice, because when you're on the phone and you're busy, people are coming and going on clinic days, right? And now you've got this person asking you this question on the phone, and you're trying to like jot down the notes and the details and the name and the date of birth and what is the exact question and what
yeah,
claim did you get, all this stuff. You're jotting that all down. When it comes through in a text message, it's all there and it's
yeah.
all in. So you actually have the time to, all right, this is the question, this is it. Let me look into it. Like you can actually spend more dedicated time
Yeah,
uh, in that and actually get back to them with a more like detailed and like specific answer for what they were looking for. And the
right.
best part of all of that is how it all migrates into and integrates into Athena. So the biggest thing that we saw we're dealing with is when we were having these phone calls with people that are asking for requests or medication or whatever it may be, we were having to go to Athena. So after we solved their question, we're going with Athena, creating a patient case so we could document that. But the great thing about OMD was that we were able to take care of that, answer the question and give them the details. And then, just hitting that check mark, and then it would just go into the patient chart. So if anyone else had to ever even like, look back or
Yeah,
see, you have the details of it. And the great thing that I think is you also know if, again, there's a few people at the office, right? So there's the doctor, there's me, there's other staff members. So we know that if there is a phone call or a voicemail, did so and so get back to that? Who got back to it? What was the conversation? Versus you can see it, oh, so and so got back to, Mr. Smith, and it's been taken
yeah,
care of and we're all good. And like we just know that done,
yeah,
versus having it to be hovering over our head, like being like, wait, did we ever get back to Mr. Smith about X, Y, and Z? So that's also just been a game changer on how we can get back to people and in an efficient manner, in a safe manner, and following all regulations in place as well. And then you
yeah,
have
yeah.
heard of it, and you can always look back on it or just make sure that it's that it's done and taken care of.
Yeah. So I'm thinking back to how OMB has evolved over time and how we've thought about things, and kind of everything that you're saying. It's just perfectly in line with the way that we view the world, which is just like the relationship really matters. Obviously, let's build simple tools that build on the patient experience, but like, we think a lot about the human element of healthcare, in that I talked before about how most of healthcare isn't fun, and because of the nature of healthcare, oftentimes it feels like the human element's really important. Like, I think there are ways to improve efficiency by automating certain things and taking work entirely off of an intake person or the doctor or the practice manager. I think there's a lot of opportunity there. I think it's just about finding the perfect mix of technology that supports those efficiencies,
Mhm.
and technology that supports the human connection and like
Right.
empathy and all of the things that
Yeah.
matter so much in healthcare that don't matter in a
Yes.
lot of other places, right?
Yes, so true, so true. Yes, because even if we are messaging and we could even have like a blanket way of saying things, we can still tailorize it and make it more personal. If there was a conversation that was had that someone was having a migraine, we can just be like, like add that personal touch to your conversation. So it's like,
Yeah.
no, we're listening. We know, we heard what you said, what the complaint was, or what the
Yeah.
problem area is, and we're addressing it, and we're aware. So I think that helps again on that human connection that we're trying to build, and kind of again just continues on to that whole experience that we're trying to build. So
Yeah.
if it's in office or out of office.
Yeah. Yeah. And what a better way to build trust on top of a relationship and to personalize things and make it feel like this is a real thing. Like there's a real person that's looking out for me.
Right.
I have a, it's amazing to see practices like yours that really understand that. Like it's really, I don't wish I still had back pain, but if I still had back pain, I wish you were closer to Vermont. I would be going.
We could do a virtual visit, right?
We can do a virtual visit. We can do it. I mean, I'm going to try to stay healthy. I've gotten my like maintenance PT that I've been doing, so I'm good so far. But I could wake up any morning and tie my shoe and then have a back spasm. It's possible.
You know who to call or who to text.
Absolutely. Urooj, this has been amazing. I love everything that you've told me about Integrated Spine and Joint Institute and what you and your husband are doing. Obviously, we see things in alignment for so much of this relationship and the patient experience, and so I'm really excited to keep working with you and learn from you as a kind of leader in the space. Like, what can we do better? Like, what's the next thing? And how can we continue to kind of think about the world as the patient experience evolves? So I'm so grateful that you took the time to do this, and I'm really looking forward to kind of staying in touch as time goes on. But this has been great.
No, same here. Thank you so much for giving me the opportunity. I mean, I am a diehard OhMD fan. I know a lot of not only my like medical friends and stuff, but also outside of my medical friends about just the services and how much easier and more efficient and effective we've just become. And that was our whole goal. Even before we even knew that the service existed, this is, I think, what we wanted. So literally when we learned about it, we're just like, this is a home run. Like it's a no-brainer, and again, the integration with with Athena, like all of that has just been so great. And even just the whole team has just been fabulous. And any questions or anything, just to kind of like even just brainstorm an idea through, or like something that we're like finding a hiccup in, or something, something we've come across, just kind of brainstorming that with the team has just been so much fun, because it's like we're both thinking the same thing, right? We're all like in the same world of how do we make this a better experience for our patients, and bring that level of service to healthcare that other industries have. So it's just been a lot of fun to kind of, again, talk to the team and brainstorm and just bring all of that to life. So thank you, really.
Yeah, no, well, we're only what we are because there are people like you out there thinking about how to use us in different ways and how to kind of make us better over time. So thank you for helping us do that. And I'm really looking forward to having another conversation in another 6 months or whenever it is.
Yeah, definitely.
And talking about what the world, the state of healthcare is at that point.